Good morning to everybody and welcome today to the One Ohio Recovery Foundation Directors June meeting. I'd like to start by asking Lord to do a roll call of attendance.
Director Bond,
Here.
Director Amon,
Here.
Director Whiston, Director Handrew,
Here.
Director Old, Director Mason,
Here,
Director Mayor, Director Miller, Director Luce,
Here.
Director St. John,
Here.
Director Worsbicky,
Here.
Director Dodge,
Here.
Director Drehas, Director Hohaddle,
Here.
Director Tyler Lee, Director Mattia,
Here.
Director Piccirilli,
Here.
Director Greta Johnson, Director Silac,
Here.
Director Gregoire,
Here.
Director Kidd, Director Radcliffe,
Here.
Director Royson,
Here.
Director Baker, Director Kleemeyer, Director Terry Johnson, Director Phil Plumer.
Here.
18, perfect, right? Okay, we have a quorum. Thank you very much to all. And we
Chair,
also want to,
apologize. Director Smitherman is here.
Director Smitherman will be mentioning you in a moment, so thank you very much. I'd like to welcome all of our guests who are joining us both in person as well as virtually. And again, we can't hear the comments if you're online, so if you would send us the email at info@oneohiofoundation.com, we'll try to tee that up as soon as possible. So our first order of business is to approve the agenda that has been sent out. And do we have any edits to the proposed agenda? Hearing none, is there a motion to approve the agenda? Can you tell who that was, Sarah?
Yeah.
We had somebody virtually make the motion. Was that Michael?
Yes.
Okay, thank you. Is there a second?
Second, Amon.
Julie Amen, second. Any discussion? All in favor, say aye.
Aye.
Opposed, motion carries. So the agenda is accepted as written. We also have in our packet the minutes from the prior meeting. We do have one slight edit that has to be made. The date correction to include the meetings of May 8th and not May 11th. So can we have a motion to approve the minutes with the correction of, including the correction of May 8th and not May 11th?
Worsbicky, so moved.
Is there,
Second.
and a second by Tom Gregoire. Any discussion on the motion? Hearing none, all in favor, say aye. Opposed, and the motion carries. Now, it's our opportunity, as we've done in past meetings, to start by taking a few minutes to remember why we are here today. Today, we would like to ask Robert Radcliffe to share his story with us. Thank you, Robert.
Good morning. As we do each board meeting, we're now going to hear a story of an Ohioan affected by addiction. Frequently, we hear that from parents about their adult children heart-wrenching struggles to survive the opioid crisis. Today's story is different how a woman endured a dark childhood marred by her parents' addictions and emerged stronger and with a deep understanding of the empathy and understanding needed to help those affected by drugs and alcohol. Gracie Poorman grew up in Franklin County, the daughter of once successful people whose lives were shattered by addiction. Gracie's father had been a boat salesman and her mother owned a dog grooming business. But both were battling addictions to opiates, alcohol, and other drugs by the time she was born. During Gracie's childhood, both her parents were in and out of detox programs in jail. Along the way, her mother sold almost everything out of their house to pay for her addiction, down to the carpet and the refrigerator. As a child, Gracie remembers time spent sleeping on a dirty concrete floor. As her parents broke up, Gracie lived with her father, but his addiction continued thanks in part to several back surgeries that fueled his need for pain pills. When Gracie broke her arm, her father trained her to fake pain to her doctors so they would prescribe her additional pain meds. Left on her own, Gracie started working at a young age to support herself. At one point, as a teenager, she forged her mother's signature just so she could get an apartment and have a place to live. When Gracie turned 18, her mother survived a near deadly fentanyl-laced overdose, only to die 3 months later after overdosing on cocaine and opiates. She was 46 years old. Eventually, Gracie's work ethic and lifelong love for animals led her on a remarkable professional path. She successfully applied for a job at the Ohio State's College of Agriculture's swine operations in Dublin in suburban Franklin County. Despite, in her own words, knowing little or nothing about agriculture or livestock, she worked hard and became the swine operations facility manager. Today, Gracie works as both an auctioneer and a realtor. She's also married and lives in Perry County with her husband and their 3 sons. Gracie is a compassionate person who knows that her parents loved her and wanted more for themselves, but she also understands that what they were battling was bigger than them. Gracie says that growing up, teachers and other role models helped her understand that her environment wasn't normal, and that others more positive situations were possible. As a result, she's passionate about working with children and young adults to support them as they journey on paths away from dysfunction and addiction. She wants them to know that while those paths can be lonely, there is always hope. We thank Gracie for sharing her story with us. Her experience shows us the importance of understanding that addiction is a disease, that blaming those suffering from addiction helps no one, and that children growing up surrounded by drug addiction need all the support they can get. Thank you.
Thank you, Robert. And let me say that Gracie is the president of Region 12. From the very first inaugural meeting, after we went from virtual to a meeting over at Muskingum University, she just stood out to all of us. And I don't know how it happens, but everybody in the room all of a sudden decides that a certain person should lead your group. And we chose Gracie because we felt that she really brought a perspective to what we were doing that was very unique, especially focusing on the impacts of children within the settings that she's identified. She's a hard worker. She actually rarely can make it even to log in to us because she works at this point in time normally on Wednesdays, but she's a leader in our organization in Region 12. So I'm very grateful that we focused on her personal story. Thank you. Our next presentation is from the state of Ohio. We are very honored to have Director Lee Ann Corin from the Ohio Department of Mental Health and Addiction Services. Throughout Director Corin's career, she's worked tirelessly on behalf of Ohio's most vulnerable populations, our children and those living with mental health and substance abuse disorders. She is appointed by Governor Michael DeWine in December of 2023 to serve as the director, and she has already begun to have an impact on Ohio. We're happy to have her with us today to share the insights of OMHAS, priorities. There we go. Director?
Okay, all right, that's okay. All right, good morning, everyone. Thank you so much for inviting Ohio Moss to present today. We thought that we would give you all a bit of a 101 on Ohio Moss funding priorities and how the resources that we are so generously provided from the General Assembly are distributed out to Ohio counties and communities. So a little bit first about Ohio Moss. As your chairman said, I've been with the department for about 6 months at this point, and I have learned a lot about the department, some things that I didn't even know when I came into the role. So next slide. This is a little bit small, but who we are. So at our macro level, we really serve to provide leadership of a high quality mental health and addiction prevention, treatment, and recovery system that hopefully is effective for our Ohioans and valued by them. What that means in reality. We have 6 regional state psychiatric hospitals that serve individuals that are indigent or forensic, meaning coming from the criminal justice system, across our RPHs. At any one given point in time, we are serving about 1,050 lives across these 6 hospitals, and we serve about 4,000 Ohioans with serious and persistent mental illness every year in these state psychiatric hospitals. We also have the good pleasure of partnering with the Department of Rehabilitation and Corrections. We have over 200 staff that are in our 26 prisons on a daily basis, providing behavioral health treatment to incarcerated men and women. We also have more than 2,300 local behavioral health providers that we license, certify, and regulate on an annual basis. We work in very close partnership with our 50 ADAMH boards at the local level, and we serve countless lives across the state through our resources. We really, our priorities haven't changed since the governor came into office back in 2019. And we really are focused on increasing prevention and early intervention efforts. If we're waiting until somebody has experienced trauma or has developed that indicated substance or mental health challenge, then we've not failed that person. There's so much opportunity and recovery happens, but we should have started earlier. We should have intervened earlier. So we really are committed to growing our prevention and early intervention efforts. The governor has said he wants to build the system that was never built. The Community Mental Health Act of 1963 made it clear that we were going to create a community-based system of care, and we were going to deinstitutionalize Americans because that's what's right for individuals. But unfortunately, we never realized that full continuum of care across our communities. So we have been investing heavily in our crisis services and building out recovery housing and prevention programming, mobile response teams, you name it. We've basically invested in it over the past 5 years that the governor has been in office. We are really wanting to help improve our criminal justice and forensic systems for individuals with mental illness. The governor recently created a working group focused on this. The fact that our regional psychiatric hospitals are at 97% capacity, and 93% of that capacity is in fact forensic, which means an individual has to effectively be purported of committing a crime before they can receive care in our regional psychiatric hospitals. And I don't think that's the system that any of us want. And then we want to grow recovery supports. We know that treatment is a moment in time, and hopefully individuals will live their life in recovery. And this is unfortunately a part of the continuum that may have received the least amount of funding. And we need to change that. Next slide. So a little bit more about our responsibilities because they are numerous. Not only do we support through financial support, but also regulation of our local systems of care and our providers. We want to provide the highest quality inpatient services to the individuals who both receive services at our regional psychiatric hospitals, but also individuals that we support financially at our private psychiatric hospitals. We want to make sure that we are developing strategies, and Ohio is in fact a national leader in gambling addiction, and we're really proud of the work that we have led the nation on. We want to make sure that that our kids and adolescents aren't forgotten in all of this. We focus a lot on the adults, but we know that there are young people out there with substance use disorders, with mental illness, with, a whole host of challenges, and we cannot forget them either. We want to make sure that we are developing strong linkages between our behavioral health system and our criminal justice system. We support thousands of Ohioans leaving our prisons and our jails on an annual basis, receive those linkages to community-based behavioral health so that they are leaving the doors with their first appointment, with their medications, to make sure that they can remain stable in the community. We do a lot of research. I discovered when I came in that one of our most impressive bureaus is our quality planning and research team. We are chock full of incredibly brilliant PhDs at the department who do a ton of research on the quality of programs, effective strategies to change the tide in these arenas. We also provide training and technical assistance, both to our providers on the workforce front, but also on the licensing and certification front. We operate the Ohio Pharmacy Services, which procures all of the pharmaceuticals for DRC, as well as our state psychiatric hospitals and some of our community-based pharmacies. And then we also have dedicated staff focused on protecting the rights of individuals in any inpatient setting. Next slide. So here's how the money breaks down, because I know this is really what you guys are interested in. So as you can see from this pie chart, 52% of all of OMOS funding flows to local communities. Much of this is through subsidy to our 50 ADAMH boards. Some of it is through direct contract with providers. So that equates to $455 million annually that we are sending out to local communities to meet community needs. And our ADAMH boards, as I'll talk about in a minute, have to complete a community assessment and planning process. So really the deployment of those resources should be in alignment with the community needs assessment that is conducted by our ADAMH boards. Our next biggest pot of funding is our hospital operating. So again, we have 1,500 staff, nurses, psychiatrists, psychologists, physician's assistants, direct care workers who are working in these regional psychiatric hospitals every day, running 3 different shifts, making sure that those more than 1,000 souls that we're caring for are receiving the highest quality care possible. Then we go into pharmacy services. Again, this is a massive operation. We have dozens of drug trucks on the road every single day. We have dispensing machines running almost 24/7, making sure that we are getting those medications out to our prisons and to our psychiatric hospitals. We, as I mentioned, have an incredible partnership with DRC, where we have staff in their prisons operating therapeutic communities and providing behavioral health care. And then last but not least is OMOS general operating funding. So next slide. These are our top 5 biggest GRF lines within the state community funding bucket. So you'll see that community investments, that $91.2 million, that largely flows to, again, our ADAMH boards for community investments. The governor has been incredibly adamant that he wants to ensure that all Ohioans, regardless of where they live in this state, have access to behavioral health care, whether that if they're having a crisis, whether that's somebody to come to them or somewhere to go. So we have also allocated almost 5 million, largely again to our ADAMH boards. Some of that is flexible funding. Some of that goes into contracts with providers to support things like mobile response or mobile response and stabilization services for young people. We also were very fortunate that the legislature increased our allocation in residential state supplement. This helps individuals transitioning out of inpatient care into community-based settings. It provides them with a rental payment, as well as hopefully some flex to meet their personal needs. These are individuals living in residential settings, potentially for the rest of their lives in the community. So really, really grateful. It's transformed lives. It's empowered our residential providers to improve the quality of the care that they deliver, enhance the homes that they operate. We support drug courts all across the state. We currently support 220 different dockets across Ohio through this 11 million. And that goes directly to our local drug courts who are certified by the Ohio Supreme Court. And then again, gambling, addiction and prevention. Some of that goes out to our county boards to support gambling addiction in their communities. The rest of it goes to help operate a helpline and so many other services across Ohio. So that's state funding, that's GRF. Now moving to our federal funding, largely comes from federal block grants, the Substance Use Prevention, Treatment and Recovery Supports Block Grant, which recently had a name change, and then our mental health block grant. So as you can see, opiate treatment leads the pack with 88.9 million. Much of this comes from our state opioid and other supplements competitive allocation that we receive from SAMHSA annually. So we are about to embark on SOS 4.0 to help address opioid use disorders in our communities. We also have, more community investments. Again, this is largely coming from our federal block grants from SAMHSA. So this is merely passed through. It comes to Ohio Moss, and then we largely distribute this to the community through subsidy, through some contracts with specific providers. Suicide prevention, some of this goes toward our 988 system that we have stood up statewide. And then women's treatment is a specific earmark in our SUPTERS block grant, which ensures that women undergoing substance use disorder treatment receive reimbursement for that care. So we are proud to be represented by 3 Adam H boards on this committee. So you all are probably very familiar with the Adam H County Board service districts. There are 50 across the state. Many of them are multi-county, some of them are single county, but these are our critical partners in this work, delivering these services at the local level, building out that continuum of care in their communities based on their community needs assessment. We thought we'd give you a snapshot of what sort of the total budget board funding looks like in big, medium, and small boards. So next slide. As you can see, in our smaller boards, a bigger share of their funding comes from state and federal pass-through dollars. And a smaller proportion tends to come from local levels. As boards get larger, they tend to have more local levy support for their work. So we just wanted to make sure that you guys kind of saw visually how these resources are helping to fund local investments. Next slide. So again, this is just representative. This is not all boards. We took 3 sample boards to sort of display how these investments that we are giving to local boards result in, community investment. So smaller boards, you can see for most of our boards, really a strong investment in housing, in treatment, with less so maybe on the prevention side of the house. Next slide. So again, I mentioned our SOS and SOR. Again, SAMHSA has gone through several name changes with this pot of funding over the years, but this is a highly competitive grant allocation that we receive from SAMHSA annually. There's always the will they, won't they continue to fund this question about our SOS funding, but we have been fortunate to receive about 97 million in SOS funding through fiscal year 2023. And this is really focused on a handful of goals that are pretty prescriptive from the feds. They've loosened the reins a little bit in the years, so it doesn't have to be exclusively focused on opioids now. We can also add in stimulants, which was a great addition that Ohio, candidly, Director Nelson was pretty instrumental in advocating for when she was the director of Recovery Ohio, but really focused on reducing unintentional overdose deaths, increasing access to treatment, prevention, recovery supports, responsible prescribing. So a great partnership with the pharmacy board and promoting harm reduction. So next slide. Again, common theme, you'll see that the majority of this funding almost half of it, we have sent out in partnership with our local ADMH boards to address their local needs. We do preserve some of it for our state-to-state partnerships, different community projects, innovation. We recently onboarded a deputy director of innovation in Ohio Moss. So really trying to focus on what are the emerging best practices and how can we as the state help scale them. And then we have sort of divvied up some of this across our various bureaus and offices. So some to our Office of Treatment, some to our Office of Recovery Supports, which has been instrumental in helping scale recovery communities, peer-run organizations across Ohio, investment in our Moms Project and awareness campaigns, and then other strategic priorities for the administration. You can see an incredibly small amount of this actually goes to Ohio Moss for any admin. In addition to all of this, I promise I'm going to be ending soon. We also invest in building out community capacity through our capital budget project. So we received 68.3 million in funded projects. That has gone in to support 344 million in total project costs. So really, we are maximizing our impact by oftentimes being last dollar in on a lot of these projects. But for Ohio Moss investment, many of these would never get built. They'd never get across the finish line. So we're really proud of that ROI that we've been able to have. We have helped build approximately 1,100 different housing units, 3 community residencies, 22 permanent supportive housing facilities, and 16 different recovery housing projects. So a lot of investment going into housing. Next slide. In addition to this, we also have some GRF that we're also throwing at at 14 different housing programs that we have in the department. Just to highlight a couple, our landlord mitigation and incentive program. This is a really incredible program in partnership with DRC, where we provide sort of a captive insurance fund for these landlords that are willing to sign up to serve individuals with substance use disorder, SPMI, and a criminal record, so that they don't have to go to insurance and then see their premiums increase. We also are incentivizing them into the pool with some small incentive funds. We receive $2 million annually to help individuals in homelessness transition out of homelessness. And then we use our access to wellness funds, which are GRF, to help individuals often experiencing homelessness, experiencing a hospitalization in one of our regional psychiatric hospitals or private psych hospitals to transition back to the community. It's $8,000 per person. It can go toward tangible goods, rent down payments, rental assistance, you name it. It's pretty flexible, and we've had some incredible outcomes with this. People who have been served by the Access to Wellness program, it's been about 1,600 since we launched this. These individuals are by far and away not having rehospitalizations, not having reincarcerations. So we're stabilizing them in the community, and they are in fact able to thrive. Last but not least, I'll just mention our workforce investments, because none of this work can happen if we don't have a robust workforce to meet the needs of Ohioans. So we recently launched our Great Minds Fellowship, as well as a Welcome Back campaign. So that has been supported through 85 million in one-time ARPA funding. If you go to the next slide. So we are investing the majority and bulk of that into providing scholarships to students who are in their second to last or last year at almost any Ohio institution of higher education. They can get a $10,000 scholarship, not a loan. They don't have to pay it back. And then if they complete at least a year in community-based behavioral health care, they can earn a recruitment or retention incentive rather. Ohio Moss also put out a 22-point workforce roadmap that we are methodically working through. The governor said it in his State of the State. We know that we're going to need 4,500 new chemical dependency professionals, 4,700 new counselors, 4,300 new social workers, and hundreds of new psychiatrists by the end of the decade. So that's a pretty short runway, given that we're halfway through 2024. So we are trying to support the entire continuum of care in the state of Ohio in close collaboration with our 50 ADMH boards. So I will open it up to any questions, or I will yield my time.
Question?
We have Director Amen with a question.
Good morning, Director. Thank you so much for being here. I have two quick questions. As regions are looking at their grant requests, can you speak to any particular gaps that you think are especially prevalent right now that they could be looking at?
Well, thank you for the question. I am deeply appreciative, looking just really at how our funding breaks down and, the SAMHSA requirements that we have on our dollars. I'd be remiss if I didn't say that prevention and recovery supports tend to be the least invested in. And that's not just Ohio. I think that that's probably national. I think that recovery supports are really getting a fresh look in Ohio in particular and across the country, because again, we know treatment is a moment in time. Recovery is hopefully for the lifespan. So we need to make sure that there are robust supports in place across all of our communities.
Okay. And the second question is, the regions have been questioning and wondering what the state is doing with their opioid settlement dollars. And I just wanted to see, do you know if any of that has been diverted to your agency?
In the 6 months I have been here, I have not been made aware that any of that money has been sent to Ohio Mod.
Right. Thank you so much. Appreciate it.
I believe Director Rosen had a question. Was that you, Michael? Who was it?
I did not.
Oh, I'm sorry, Judge Matthias, I apologize.
Director, thank you for coming. My name is David Matthias. I'm a common pleas drug court judge here in Cleveland. I think your organization does a fantastic job. Been involved with former Director Chris's work and welcome you to our meeting and your role. My question or something to think about is, we're here dealing with substance abuse and the opiate epidemic, and there's not a lot of detox out there for people. And obviously, detox for opiate dependers is not, life-threatening, but from the point of view of someone in the throes of dependency, they're hard to convince to get help. But some days they wake up and they're sick and tired of being sick and tired, and they don't know where to go. There's not a lot of detox out there, even in well-funded Cuyahoga County. The hospitals, frankly, are not in this behavioral health game. And detox for someone who's opiate dependent is relatively inexpensive. It's basically palliative care. You're trying to get someone through withdrawal with less discomfort. I'm not sure I really have a question. I just would ask that you consider with your organization programs that can incentivize our friends in the hospital community to provide detox, just like they would provide emergency room care to someone suffering a heart attack. Everyone knows when, they're having a heart attack, where to go. They go to the ER. When someone's sick and tired of being sick and tired, they might show up at the Cleveland Clinic's emergency room, but they're going to get turned away because the clinic doesn't do detox except at Lutheran Hospital. So anything you could do to incentivize hospitals to provide a palliative care program to make detox more available will assist us in our role of trying to move, the hundreds of thousands of Ohioans who are opiate dependent into the world of recovery. Thank you.
Thank you. I will sort of demur this question to my colleague at the Department of Health, and we can certainly take this back to him and provide follow-up information to you all. Certainly, we invest, as I said, locally in the continuums of care. I have been to a handful of communities and I've seen detox facilities that are currently empty. I've seen some that have wait lists. So I appreciate the fact that there may be capacity challenges statewide, but I do know that Dr. Vanderhoff at the Department of Health has great collaborative partnerships with the hospitals on inducting individuals into MAT. We are supporting this at our jails on a reimbursement basis. So we have some money in this space, but certainly we can follow up with Director Nelson on additional details.
Well, hearing no other questions, thank you, Director, for your presentation. It'll help all of us as we do the work in the foundation. Judge, thank you for your question. That was Excellent. I know I live in Appalachia and we have the same thing, same issue in Appalachia that you have in Cleveland. So thank you very much. I'd like to move on to our committee reports. So today, the Audit and Finance Committee Chair Evan Claymeyer was not able to join us. I think as many of us might remember, he is a new addition to his family and obviously those are our priority obligations and God bless his family. So last month, the committee met, discussed several items that will be shared with you today, and these were in the packet. You should have seen the copy of the fiscal policy with markups that we'll be going through this morning. Annually, the Audit and Finance Committee reviews and if needed, makes updated fiscal updates to fiscal policy. This year's changes reflect a couple of additions, some substantive recommendations, and some are clarifications and corrections. For our more substantive changes, we are proposing to move the approval of the foundation's budget from December to October. This will make the process of operation more efficient for our staff to align contracts and services for the next fiscal year. Next, we would like to align our fiscal policy language with the MOU and our code of regulations and change the allocation and settlement dollars from when received to annually allocate. For reference, in the MOU Section D 11F and in the Code of Regulations, Article 11, Section 11.01A, it states, within 90 days of the first receipt of any opiate funds and annually thereafter, the board, assisted by its investment advisors, excuse me, and expert panel shall determine the amount and timing of the foundation funds to be distributed. Next, we're proposing to delete the language related to the CFO preparation of the submission of settlement claim, as there is no settlement claim process, making this language no longer necessary. We are also proposing to remove the requirement that grantees receiving $750,000 in a single year submit results of a single audit. After discussion, we recognize this as an expensive request and not audit firms will be able to perform this requirement. Instead, we are looking forward to working jointly with the Grants Oversight Committee to establish a robust reporting requirement and evaluative tools for our grantees. For our new additions to the policy, we have recommendations from our auditor that details Foundation's accounting records will recognize, record, and report in kind expenses and revenue. The foundation will also monitor supplier invoicing to ensure all appropriate payables are recorded in the period of obligation. All other changes represented in the policy are simple corrections to improve the policy. At this time, we're recommending this policy be adopted by the board. So is there a motion to approve the updated fiscal policy?
So move.
By a motion by Mr. Lucci or Luce,
Second, where's Vicky?
as second by Jeanette Wisbisky, who I've worked with for many years, and I'll get her name right one of these days. Any discussions on the motion? All in favor, say aye.
Aye.
Opposed? And the motion carries. Next, we'll move to our financial report discussion. Up to date to follow up with the Audit and Finance Committee report. I now turn over to Jim Quinn to share the unaudited 2023 financial statement details with the board.
Thank you, Director. So we're approaching the mid-year of our fiscal year in July here, and we are on target on all of our budget, actually below target on most budget items to date. In May, we obligated $107,000 in total, $87,000 from the operating budget and $19,000 from the grant budget. We can move on to slides. We can move the next one too, probably. Okay. All right, so in May, we netted 319,000 in cash. 413,000 from interest earned, less the expenditures of 94,673 in disbursements. We expect, we just got word here yesterday that the Janssen payment year 4 will be received this month. The final allocation is 16.5 million. We expect the distributor payment 4 to be in July as previously scheduled. I think we talked about the schedule last month. So payments right now are on schedule. Any questions?
Hearing no questions. Thank you, Jim. Is there a motion to approve the May unaudited financial report?
So moved.
Was that Michael?
Yeah.
All right. Dr. Rosen, second to the motion.
Vicky, second.
By Jeanette, the second. Any discussion on the points? Hearing none, all in favor, say aye.
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 Opposed, and the motion carries. So before we move on to the next committee, I'd like to offer a reminder of those who have yet to complete the related party questionnaire for 2023. You should have received an email from our auditor to complete. Please return this questionnaire directly back to Heather Dolan and her auditing team at SEO. We hope to have this completed as soon as possible. Next, I'd like to move on to our Grant Oversights Committee report and turn it over to Director Tom Gregoire, our Grants Oversight Committee Chair.
Just on the related party questionnaire, I have never received one. Could you ask her to send me one?
We will take care. Yes, sir.
Thank you.
I have not received one either.
Okay, Dr. Rosen and Judge Mattia and Tom Johnson.
We'll get it to you. And if anyone else is in that position, we will make sure to get that to you as soon as possible.
And we apologize for that. So thank you very much, Tom Gregoire.
Let me start as I should always be thankful to our board for meeting twice a month and our staff who has us well prepared to meet. We're getting to the fun part. We're very close to beginning to it's out. We're working on some of the fine details. And right now, fine details like what do we want to see on application abstracts? What is the procedure which we will bring you in some future meeting about how we'll address proposed amendments for the grants. Multiple regions are now 5 are now reviewing their grants, so it is an exciting time. Laura is going to give us a further update. She gave us some information in our last meeting about the status of grants, and we asked for a bit of a slice and categorize. So here we go. So I'll turn it over to Laura.
Thank you. Hello, everyone. We just have some updated numbers for you on what the foundation received in the grant applications. If you recall, the last time we shared these numbers, the submitted applications were over 1,500. There were lots of duplicates and database cleanup that had to happen. So here today, we have those finalized numbers with a total of 1,442 submitted applications from 777 unique organizations. 38% of our applicants applied to multiple regions, and 392 of these requests are for $100,000 or less. And then below, we have information on the project length, which our most popular request being 36 months. And then the institution type, with the most common institution type being nonprofit organizations. Good. And here we have the breakdown by abatement strategy, which I will point out our 2 most common were prevention and recovery supports, which we just heard is a great area needing funding right now. So that's exciting to see that kind of alignment. And this high-level summary information is also being shared with the region for their specific region breakdown. So they'll be able to see how their own region fits into these same areas. You can go to the next slide. And here, I know it's a little small. Hopefully you can see, this is just the breakdown by region. The highest amount per one region was 164 in Region 1, and then the lowest was 26 in Region 16. But we do still feel that 26 is a competitive process with lots of great projects for them to select from. And I will just call out that we received over $500 million in requests for this funding. So lots of great areas and opportunity to fund. Oh, would you like to do this? Or you want me to?
Before we move on, I
yeah.
did want to add a statement or two in there, because when you see a number like $500 million, I want us to pause for a second. One of the things that we know is that there are going to be great projects that don't get funding in this first round, but I want us all to remind ourselves and those in the communities and these organizations who are doing this great work that this is our first grant round. And so there will be other opportunities. And we really want to communicate that as much as possible to these groups so that they understand as we go through this process that there will be some yeses and some nos to great projects. And I think that is just a challenge, but an opportunity for us as we think about future grant rounds and where we want to put funding in the other opportunities. But Tom?
I think I was going to echo that, but then ask you to back up to your slide just to see if any of our membership, actually the one before. Yes, there may or may not be questions about this, so I wanted to make sure.
Will these slides be available somewhere?
Yes.
Yes.
Anywhere, on the website, okay. All right, thank you. Yeah, that caught my eye too, the prevention and the recovery support. And I would hope there is a future conversation where our foundation thinks about where it sits in this in the prevention recovery continuum ecosystem as other places like Ohio Moss and the Adams Boards and other foundations. Where's our unique impact? But that's a future conversation, and I like that whatever else these are, there are impressions need, and there is clearly high need in prevention and recovery. So for that. Questions? Yeah.
Yeah, thank you. Senator Terry Johnson. So I'm happy to see I'm sorry. Like this, it's on. I'm colorblind.
Oh, well, that doesn't help. Here we go. Perfect.
All right. So we learned something about Senator Johnson today. Yeah, watch out around red lights, right? Very happy to see the proportions that are up there, particularly for prevention. Prevention's got a nice long line. But something I'd like to see us get involved in if we can, is somehow getting a more standardized approach to prevention. Because you talk to people that are doing prevention and they're all over the place. Little puddle here, little puddle there, a powder puff up there. And we don't really have a lot of measurable metrics to judge what's going on. And having been in this for so long as I have in various facets, I've long advocated for cutting off the supply of addicted people rather than trying to treat an ever increasing number of addicted people. As a person that actually treated addicted people for 9 years, the last 9 years of my medical practice, I found that I was on the wrong end of the stick in every aspect. Very difficult, particularly with opioids. And so prevention, I think, is going to be a key for the state of Ohio. And overall, the thing that we really need to focus on. But right now, we've got so many different kinds of prevention, so many different curricula, so many people doing different things, and no way to really evaluate it. I think we need to focus on that as a board.
Yeah, I appreciate that. If I could comment on that quickly, and I'm now green too, so if you missed all that other stuff, you didn't miss much. But I hope the presence of an expert panel contributes to that conversation, that we focus exclusively on evidence. We've all seen in any of these domains things done that demonstrably don't work, and we're not going to fund those. I also hope over time that we take opportunities to learn as a panel about what is best practice, what is the best evidence in recovery and prevention and all of those. So I just want to second your motion, as it were. Director Johnson.
Thank you. Perhaps this is a good time for this body to invite the Attorney General's office to come and talk about how they are investing their percentage of the settlement. And if this is something that our OMAS director has identified as a real need statewide, and we are all shaking our heads in agreement, perhaps it is time for us as a body to speak to the Attorney General's office as this is a statewide need, and perhaps that part of the administration could direct some of the investment in that way, and to Senator Johnson's point, to some structured way or some measurable way that we can all reap the benefits of. So at this point, I guess I'm asking the staff if they would invite the Attorney General's office to speak to this group so that we can ask Director Lehman's question about what their percentage is being invested in, so that we have a better idea as we are making our recommendations at the regional level of what is being invested in at the state level. Certainly, we don't want to duplicate efforts. We don't want to supplant funds that are coming from the state. So that would be my request.
Appreciate that. Very good point. If there are not other questions or comments, we'll let you continue with your presentation, please.
Update. We just have a quick update for you on where the individual regions are in this process. So this chart moves progressively down, with the bottom being reviewing grants. So we have 6 regions that are actively reviewing their grants. We have 4 who have their meeting scheduled, and after that meeting, they get their grants. And then the top line is there are 9 who are still finalizing their grant reviewer roster and completing the related party questionnaire, which we need those related party questionnaires done before we can send the grants. So that's, or the applications, excuse me. So this is where all of the regions are, and we look forward to moving all of the regions down to that bottom line and getting the applications into the hands of the reviewers.
Very
Thank
good. I believe that's, unless there are questions, that's the grant committee report. Well done. Thank you, Laura.
Well, thank you for today's update. Thank you very much, Tom. Now, the next item is the executive committee report, and I'd like to take a moment to discuss our board terms. Last month, we discussed that each of us were assigned a term that was approved by a full board. And when the foundation was established, several of the terms have expired today. That being said, I'd like to thank Christopher Smitherman. If you're still on the line there, Christopher, he informed us at the last meeting that this would be his last. Chris has always offered us sound advice to the foundation, and we've truly valued his service. So with that, I'd like to thank you, Chris, for your time.
Thank you very, very much, Mr. Chairman. And I have enjoyed my service with One Ohio and working with all of you to stand up. I think one of the most important entities for our state. I want to thank Director Nelson, just doing a great job. And I have all the confidence in the world that the grants are going to be going out the door, and that money is on the way. And that those resources are going to really help families that have been harmed by this national crisis. I'm going to continue to be here and advise anytime anyone needs any help. On a personal note, I shared at the beginning when I began to serve that my wife had recently passed of breast cancer. I'm a single dad. That's part of my story. And I now have a 16-year-old daughter that I have to pay even more attention to and be supportive of. So part of that reason is just making sure that I'm committed to what I need to do at home. But I hope to be back to One Ohio. My service isn't done. And I want to really thank the governor for trusting me and supporting me and being a part of One Ohio. So thank all of you. I will continue to stay in touch with what's happening with One Ohio. And again, thank you so much, Mr. Chairman, for the opportunity to say my farewell.
Thank you again, Christopher. Now, for the rest of us, please continue to contact me. I've received several emails over the last 2 or 3 days regarding reappointments. I think everything's been moving along pretty smooth. We have the board retreat coming up in July, and I might say I filled out my survey. It's very important because state what you want to eat. So let's get down to what really, it's pretty important. So yeah, Alicia, Lori, and the rest of the staff are all here to help you should you need anything. Just let us know. Next, want to give you some updates from the executive committee that was able to meet and discuss plans for that meeting and for the retreat. The board retreat will be next month, and we need to prepare the details. It's going to be on July 10th. We'll begin the board meeting at 9 a.m., which is a change. So again, there might be overnight accommodations, and that was one of the questions on the survey. And Alicia's informed me that we've negotiated a very good rate with the hotel. Thank you. The meeting will be at the State of Ohio Library, the State Library of Ohio, which is located about 5 minutes north of here on 274 East First Street. There's the building on your the presentation there. And good news is, it's my understanding, it's plenty of free parking, high priority. Thank you. You see, I'll just move on here. For those who are here in person today, the survey was at your seat. And for those who are joining the meeting virtually, you should have received an email in your inbox from Lori. This will help us make the accommodations. I also want to take a moment to share a travel policy and supplemental materials that Lori's prepared that is also in your packet. So please take a moment to take a look at those. I think the last item is the Personnel Committee, isn't it? Okay. So yeah, we never like the word last but not least, but we have Director Julie Amen to provide the Personnel Committee update.
Yeah, the Personnel Committee met on Thursday, June 6th, and we continue to review the draft handbook. Some sections will be included as appendices, as they may need updated more often than the actual book. So we reviewed sections 3 and 4, and we also discussed insurance offerings and carriers for upcoming business. And that ends my report. Thank you.
Thank you, Director. Thank you, Director. And any questions? So I might go off script since we're going to be in a meeting room all day. My background was always at ODNR or PUCO when we would do strategic planning. So we'd always tell people to dress comfortably. It's an all-day meeting. So I just want to again thank you for being at today's meeting as we wrap up. We'll see you on July 10th at 9 a.m. And again, I want to thank Director Leanne Corin, who was with us today. That was a wonderful presentation. And hearing nothing else, is there a motion to adjourn? By Greta, motion.
Second.
Second by Tom. All those in favor say aye.
Aye.
Opposed, and the motion carries.